A patient receives a severe psychiatric diagnosis from their clinician. The documentation is extensive, but when that heavy file is submitted for a disability claim, that clinical record meets the administrative shredder. A documented clinical diagnosis, regardless of its severity, does not automatically constitute a vocational disability under Social Security Administration guidelines. The Social Security Administration serves as the ultimate arbiter of disability, shifting the focus from the doctor's office to an administrative framework. Adjudicators bridge the gap between medicine and work using a specific tool, the Mental Residual Functional Capacity Assessment, or MRFCA. For the experts deciding these cases, the core question is whether a claimant's condition crosses the threshold into a substantial loss of vocational capacity. Practitioners often assume a substantial loss is defined by standard clinical metrics or standardized test scores. The SSA strictly rejects defining mental impairment through standard test percentages or standard deviations. A substantial loss occurs at the moment an individual becomes unable to perform a basic mental activity required to sustain regular, competitive employment. Competitive, unaccommodated work requires a rigid baseline of cognitive and social capacities. This baseline remains the same regardless of the job title or the industry. Adjudicators look for 14 specific cognitive and social demands that constitute the bedrock of the national labor market. Failing to meet the functional threshold of any single demand among these 14 triggers an administrative finding of substantial loss. Context determines the outcome. The same psychological limitation can yield vastly different results depending on the specific demands of the work setting. The basic standard of neatness and cleanliness illustrates this. The threshold for what is considered functional varies by environment. A role dealing with the general public requires a worker to meet a high standard of grooming and cleanliness. That same standard relaxes significantly within the utilitarian setting of a factory. In extreme environments, like a coal mine or a stockyard, the requirements for neatness fall to the absolute minimum. We see the same pattern with agoraphobia. Severe cases that prevent a person from leaving their home preclude all competitive employment. However, a mild case might still allow someone to travel to a familiar, static setting each day, which would not necessarily preclude all work. Adjudicators cannot view a limitation in a vacuum. Its severity is defined by the specific occupational environment it occupies. The 14 cognitive baselines are organized into 4 pillars. The first pillar is memory and execution. This pillar covers the ability to understand, remember, and carry out very short and simple instructions. If a person cannot perform simple, single-step tasks independently, they have failed the competitive baseline. The second pillar focuses on the temporal metrics of work: concentration, persistence, and pace. The SSA requires a specific, measurable metric, the ability to maintain attention for 2-hour segments between breaks. A worker must follow a schedule, maintain regular attendance, and arrive punctually with customary tolerances. This routine must be sustained without the need for special or constant supervision. The final pace requirement is the ability to complete a normal workday and work week. The claimant must maintain a consistent pace. They cannot require an unreasonable number of rest periods caused by psychologically based symptoms. Even with a perfect memory, a claimant who cannot sustain the pace of a 40-hour week has suffered a substantial loss. The third pillar focuses on the external dynamics of the workplace: social interaction. The baseline environmental demand is the ability to work in coordination with or in proximity to others. This requires the worker to exist near their colleagues without being unduly distracted by them. Vertical demands include the ability to ask questions, request assistance, and accept instructions from a supervisor. A critical failure point is the requirement to respond appropriately to supervisor criticism without exhibiting behavioral extremes. Peer relations require the worker to get along with colleagues without distracting them or exhibiting outbursts. The final pillar covers adaptation, dealing with workplace volatility and safety. Workers must respond appropriately to routine changes and maintain basic standards of personal hygiene. Finally, a worker must remain aware of normal workplace hazards and take appropriate precautions. These social and adaptive pillars establish that competitive work depends on an individual's ability to navigate the social friction inherent in a human environment. This 14-point model represents the absolute bedrock of the competitive labor market. To test this model, imagine a worker who passes 13 of these criteria perfectly. They have a sharp memory, perfect attendance, and they adapt quickly to change. But this worker has a single limitation. They cannot accept a supervisor's criticism without exhibiting a behavioral extreme. Despite passing 92% of the required cognitive demands, the inability to perform this single mental activity collapses their vocational profile. Substantial loss is a binary system. A single structural failure eliminates the viability of the worker. The Mental Residual Functional Capacity Assessment targets a specific metric, the functional viability of a worker, rather than the clinical severity of a psychiatric disease. To build a defensible disability determination, medical and vocational documentation must move away from abstract clinical percentages. Evidence must speak directly to these 14 baseline demands, because in the eyes of the administration, function is the only metric that matters.